Good afternoon, friends. Today we will be discussing a very common neurological disorder or a neurological condition, headache. Almost all of us have experienced headaches once in our lifetime. It is such a common neurological condition. So what exactly is headache? Ideally speaking, headache is any sort of pain that happens in the head. So what is head? Head is this part from above the eyebrows. We run a line across the head to the occipital. Occipital is the posterior part. So anything that happens, any pain that happens in this part is headache. Beyond that, this is the facial pain. So what are the common causes of headache? Headache is actually divided into two types of causes. They can be primary and secondary. Primary cause refers to pain arising out of some associated condition in the neurological core itself. That means there is no associated thing apart from headache, whereas secondary causes are because of some lesions or some masses in the brain that can give rise to headache because of raised pressure. Then it can be because of systemic causes, causes apart from head, apart from neurology, like hypertension, any drugs that can cause headache. The most common type of headache that we see in general practice is migraine, which most of us know migraine as hemicranial, occurring in one half of head, associated with vomiting, lasts for 5 to 6 hours and subsides by itself or by taking some painkillers. So migraine is the most common type of primary headache, and the other primary headache types are things like tension type headache, cluster headache and other headaches of those categories. Important thing about migraine is it usually starts slowly, and some patients with migraine can get pre-migraine symptoms in the form of lightheadedness, feeling dizzy, or they get those feelings that we are going to have headache in due course of time. This starts with mild headache, which starts hemicranially, usually in the periorbital region, and then it spreads in a hemicranial fashion, either from back to front or front to back. That is not a very common thing. This is associated with nausea, vomiting, a kind of repression to light and sound. People want to stay close, stay indoors, do not talk to anyone, and with time these symptoms regress and the headache improves in about 4 to 6 hours, usually by treatment or sometimes by other effects like sleeping or quietly lying down for some time, resting for some time. Migraine attack typically is precipitated by empty stomach, going in sunlight, lot of exertion, not having adequate sleep, and these are relatively different for different patients. Usually patients have family history, like migraine, which is more common in females. They will have a history whereby their mothers or their grandmothers or uncles or aunts or father would be having this symptom of migraine. So apart from migraine, the other important causes of such type of primary headaches, whereby no other cause can be known for headache, are cluster headaches and tension type headache. Tension type headache typically occurs when the muscles around the head are increased in tension. They have an increased tensile capacity, and that gives rise to headache. And most common cause of tension type headaches are usually stress and anxiety. And apart from that, there is cluster headache. In cluster headache, there is lot of autonomic dysfunction, whereby we mean that symptoms around the headache areas, the eyes, the nose, they also get some kind of symptoms, like there will be increased redness, increased tearing from the eyes, increased discharge from the nose, and patients will have lot of tearing and lot of pain in the eyes. These kind of autonomic symptoms can happen as clusters, or they can happen many times a day, when these are called as SUNT or SUNA kind of headaches. We will not go into the details of those headache types, and will restrict ourselves to migraine and other related headache types. Important in migraine and other headaches type, when patients usually come to us, is to really see if this is only a migraine kind of headache or a simple cluster or tension type headache, or is it some serious condition that headache is a presenting feature of. So what I suggest for all the patient groups is to kindly contact a physician nearby whenever these headaches are out of proportion to what headaches you usually get. So usually if some patients get headaches about 3 to 4 times a week, these headaches are associated with lot of vomiting. Headache is very severe, headaches are continuous, they are not coming down with any kind of painkiller medications or rest or adequate sleep. then you should always consult a physician. As being neurologists, our idea in treating patients with headache is to find out what kind of headache this patient has and do they require any further investigations. Mostly patients come to us and they always demand that we should get a brain imaging done to rule out any severe or any bad cause of headache like a brain cancer, which is very common apprehension in patient relatives who usually come to us when they seek attention for headache. I should tell you that headaches usually do not require a CNS imaging, a brain imaging like a CT scan or MRI brain, unless these patients have severe headache, acute onset, that means headache has just come up over 2 or 3 days and increasing in intensity. Patient is getting more sleepy, more drowsy, his activities of daily life are getting affected, he is having some other neurological condition along with headache like seizures, he is very drowsy, he is having paralysis or weakness. In such cases, we do recommend an urgent CT scan or a MRI brain of the patient. In other cases, if we take a very good history, it can, with the history itself, we can define that this patient is having a primary or a secondary cause of headache. For most of the primary causes of headache, if we are sure that this is a primary headache and not due to some other major structural abnormality or any other lesion in the brain, we are quite sure that this is primary headache and this will improve with some conservative treatment. Usual treatments that we give in these patients are amitriptyline, which are tricyclic antidepressants, then treatment for migraine prophylaxis and for acute attacks in the form of painkillers. We can give triptans, which are acute treatment preventers and treatment modalities in patients of migraine. We can give propranolol, which is a specific drug that is useful in treatment of migraine patients. Apart from that, there is a whole list of medications that can be given in these patients of migraine and other related headache types, which are usually primary in nature. A take home message about headaches and treatment of headache is always be sure that your headache is not something out of the blue moon. It is not very acute in onset and is not associated with severe vomitings, multiple episodes of vomiting, any drowsiness, any limb weakness, any seizures, and if anything of this kind happens, you should immediately attend to a physician. Always maintain adequate sleep, adequate hygiene. In this kind of society where there are a lot of clashes and lot of stress going around, anxiety is itself another cause for building up migraine and tension type primary headaches. In those cases, we should always look for relieving our stress. So, adequate yoga or mental relaxation exercises. In case these migraines or these headaches are not responding to medical treatment, such stress releasing measures can be of help. And always take care that headaches should always be attended to by physicians if they are out of proportion to your usual kind of pains that we usually get. Thank you.